These are some of the key factors to maintain health and improve longevity and lifespans. And that is the red light that you're seeing. I hope you all get a chance to try it. And if you have one at home, make sure that you're using it 5 days a week. Don't let it sit in the closet. Get it out, use it every day. Here's how you use your red light safely and effectively. The first rule is never stare directly at the LED lights, especially when you're doing a facial treatment. Make sure that you always keep your device approximately 3 to 6 inches away. When you're doing a facial treatment, I would err on the side of 6 inches, but if you're doing a body part like a knee or a shoulder, you can go a little bit closer, but somewhere between that 3 and 6 inch distance is ideal. One of the other rules is you only want to be in front of the light for the amount of time that you're trying to achieve the desired goal. So just don't go beyond that, because then you can actually create some fatigue and other issues. So stay within the prescribed time of treatment. Make sure that you don't look directly at the LED lights, and keep the device 3 to 6 inches away from the body part that you're trying to treat. To use your red light, the first thing you need to do is plug it in and then power it up. There's a power button on the back. You just turn that on. Red light means it's on. Now it's ready to go. So these devices are fairly easy to control. There's basically 4 knobs that control all the settings that you need to worry about. So the first setting is red, the next setting is near infrared, and then the second 2 settings are your timer. So there's a plus and a minus on the timer. So the red light is this button right here. That's gonna penetrate approximately 1 to 2 millimeters. And then if you turn your near infrared on, that's gonna penetrate about 25 millimeters, which is equivalent to about 1 inch. So that's gonna go much deeper into the body. Before you turn on the red and the near infrared, you can set your timer. So if your treatment time is gonna be 10 minutes, you go ahead and hit the timer, and that says 25 minutes, and it will reduce in increments of 5. So now I'm down to 10 minutes. And then once I turn the red light on and the near infrared, now that's gonna start counting down from 10 minutes. And then you can add time or subtract time depending on what you're trying to do. So fairly simple to use. The most important thing is when you turn the unit off, make sure that you turn off the red light and the near infrared. The near infrared is not visible, so when you turn off the red light, you won't know that the near infrared is still on, except you hear the fan running. I always power the machine off in the back when I'm done using it. After you cycle through your treatment, it'll shut off, and then you just turn the power button off, and then you're done. Now that you have your red light powered up, we're gonna work on how to apply this clinically. So for direct therapy, whether we're treating a joint or skin or something like that, we're gonna use the red and near infrared setting, and then we're gonna have it positioned approximately 3 to 6 inches away from the body part. For the face, go all the way to 6 inches away, but for other body parts, you can go as close as 3 inches. The most important thing is that light diffuses. So if you're too close to the device, it's not gonna diffuse and penetrate and get all the areas that you're trying to treat. So let's say we want to treat a shoulder. First thing is you set it up on a table, and if you're having shoulder pain in the front of the shoulder, you're going to set this up so you're about 3 inches away from that. It's preferable that you don't have any clothing between you and the light source, but if you need to, you can wear a white t-shirt or something like that. If you're cold, I prefer that you actually aim it directly at bare skin. If you're treating the side of the shoulder, you can just turn this way, and then the back of the shoulder, you can just turn around and again, treat the shoulder that way. Now for the knee, which is another common area that we treat, again, you wanna find a stool or something like that. So you wanna set this up so that it's about 3 to 6 inches away from the knee. So if you're treating the front of the knee, you'd be positioned like this. Alternatively, you can stand up while you're getting the treatment. And again, you wanna be about 3 to 6 inches away. This way you can treat the front of the knee, you can treat the side of the knee, you can treat the other side of the knee, and then you can treat the back of the knee this way. And this is gonna get the whole knee joint covered. And again, you're gonna be about 3 to 6 inches away. So once you have your red light positioned over the joint that you're trying to treat, then you're gonna wanna power up the device, and then you're gonna wanna set the desired time. Then you're gonna wanna power up the red and near infrared settings. You set your time, then you turn on the red light, and you turn on the near infrared, and now we're ready to go. So now that you know how to set up your red light, let's get down to the nuts and bolts of how you're going to apply this and when you're going to use it. The red light and near infrared have many different effects on the body. One of the most prominent effects is a reduction in pain and inflammation. It's very effective for all kinds of joint pain, muscle pain, acute and chronic injury. This is a great tool to use if you've had an acute sprain of an ankle or wrist or any other body part, tennis elbow, golfer's elbow, you name it. Low back pain, very effective. You can treat anywhere from 10 to 20 minutes per day per body part. Usually I recommend 5 days a week, taking 2 days off. You can go a little bit longer, and if you're treating a knee and you have pain in both the front and the back of the knee, you might want to do 10 minutes on the front and 10 minutes on the back. If it is an acute injury, you want to make sure that you're using ice, particularly in the first 24 to 48 hours of an injury. For more chronic conditions like low back pain, this is going to be a longer process to help you recover from, but generally you can do 20 minutes, 5 days a week on the low back, and you're going to get very good results with reduction in pain. One of the other great benefits of the red light is it actually enhances the production of ATP. ATP is the energy medium of the body. So every cell in your body has mitochondria where ATP is made. We have receptors within the mitochondria that actually will absorb that red light, stimulate those cells to actually increase the production of ATP. So the red light is an awesome adjunct to your treatments because you're actually going to increase your production of ATP, facilitating cellular repair and also improving your overall energy status and feeling better in general. To actually stimulate the ATP production in the mitochondria, there's really two applications. You can do both front treatments, meaning you're treating your chest and abdomen, or you can treat your lower back and upper back. I prefer the front treatment. I find that to be very helpful. It's also good for lymphatics. So it actually helps with lymph flow, which is actually going to help get some of the debris and other things that are kind of outside of circulation back into circulation so you can detoxify properly. One of the other great benefits of the red light is treatment of our skin. So the red light will actually enhance collagen production, so you can put the goggles on while you're having that light directly on your face. And again, you want to keep it about 6 inches away from your face. It's going to help facilitate reduction of fine wrinkle formation by increasing that collagen production. Alternatively, you can keep your eyes closed and not use the goggles, but just don't open your eyes and stare into the LED lights for a prolonged period of time. One other really great application is acne. So for active acne, the red light will actually help kill some of the bacteria that's causing those pustules in the skin. For acne and rosacea, red light is very, very effective. Killing those bacteria and reducing the pustules is going to make the skin look better. There's another aspect of red light therapy that I'm super excited about, and that's what we call ambient circadian alignment. What does that mean? Basically, in the retina of our eyes, we have photoreceptors, we have light receptors. So when the sun is coming up over the horizon, what spectra of light is the sun producing? Mostly red and near infrared. It actually stimulates the circadian rhythm. It increases our metabolism. It helps with hormone production. And at nighttime, it has the benefit of actually increasing melatonin production, which will facilitate more restorative sleep, more regenerative sleep. So when you wake up in the morning, you're more refreshed. For instance, in the morning when I'm getting ready for work, I have the red light on in the room. I'm not staring at it. I'm not even close to it, but it's just in the room, lighting up the entire room. And I leave that on for about 10 minutes. Before I go to bed, I do the same thing. I turn it on. It's just in the room. Basically, it's not shining at my eyes while I'm reading, journaling, or doing my Sudoku and crossword puzzles, trying to keep my brain healthy, getting those photoreceptors stimulated, getting my melatonin production increased. Now I'm going to have a nice restful sleep, wake up refreshed and regenerated. One of the reasons I'm super excited about partnering with Red Vibe is because they've created a product that actually delivers the lumen power and strength necessary to actually have physiologic effects on the body at a relatively affordable price. So I've been doing photobiomodulation, which is just the term for light applied to the body for a variety of conditions for the past 26 years. And I have multiple devices here in the office that we use for all kinds of conditions. Now it's nice because patients can have this at home. It's like part of their medicine cabinet. They can use this every day for a variety of applications. These are some of the key factors to maintain health and improve longevity and lifespan. So I'm super excited. I hope you all get a chance to try it. And if you have one at home, make sure that you're using it 5 days a week. Don't let it sit in the closet. Get it out, use it every day. One important factor to consider is there's a lot of red light manufacturers out there. Amazon has plenty of red light out there. There's all these applications using masks and different devices. The most important thing is that the device is able to deliver the power necessary to affect change. And a lot of devices out there, especially the less expensive ones and those that are soft and you can wrap around your wrist or body part, they don't deliver the lumen power or the wattage necessary in order to affect the change within the cells that we were discussing. So be careful when you're purchasing a device. Make sure that it has the specifications necessary to affect change so that you can get full benefit from that. Hi, thanks for watching the video today. When I have time, I love to make these videos because I love to educate about health and wellness. If you enjoyed this video, please make sure and subscribe and maybe check out this next video. YouTube thinks you're gonna like this one. If you have any questions you'd like me or my team to answer, please leave them in the comment section below. See you in the next one.